Guys, you are here with North Kansas City Hospital, and we have is it Deboest?
Yeah, pretty close, yes.
Woohoo! She's here with us today to talk about vitamins and supplements. So, Allie, I will go ahead and let you take it away.
Okay, yes, everyone. I am a pharmacist here at North Kansas City Hospital, also Meritas Health in the Coag Clinic and Briarcliff Clinic. So I kind of hop all around. But today I will be talking to you guys about vitamins and supplements, what you need to know, what you don't, and what just to look out for. With that being said, I kind of just want to give an overview of what is a vitamin. So it's an organic compound that people need in small quantities. Typically, we can get this amount from our diet, so from our food that we're eating or drinking, depending if you're making a smoothie or something. But essentially, our body isn't able to make enough of what we need. So this is where we're supplementing with our diet. And essentially all our vitamins and minerals, they play different roles in our body to make sure that we can function appropriately. Now, if we're going to supplement, ultimately our goal of supplementation is to make sure that we are preventing any deficiencies, replenish our stores, keeping up our nutritional status. And ultimately, if we do have a deficiency, a self-treatment with a vitamin is not ideal. We would want a deficiency to actually be seen and managed by a medical supervisor, so such as a physician or a nurse practitioner, someone else that can kind of keep an eye on the deficiency and how that's progressing as well. Now, I want to be honest with you. How do you pick the right one? And the truth is, not all vitamins are created equally. So believe it or not, the FDA does not regulate any form of dietary supplements. So when a new supplement is coming to the market, they do not have to show that it's safe or effective before it can come to the market. So if something new is coming on hot and fresh, it's something to be aware about that there has been no true regulation going on with it. But there is a program that some vitamin makers, if you will, do follow, and that is the Dietary Supplement Verification Program. It was created by the United States Pharmacopoeia. So this program essentially does that extra step. So it's inspecting products for their purity, making sure that it's saying what it is, proper pharmacokinetics, that it's safe for our patients, and it's in compliance with good manufacturing practice techniques. So these products typically have the USP mark on their verified products, which is in that top right-hand corner of my slide that has that little USP stamp of approval. So the main ones that I see that patients kind of bring to the counter or bring with us that have this stamp of approval is Nature's Bounty, Nature's Made, and even Costco's Kirkland brand has that extra USP stamp of approval. So it's gone that extra step. So you truly do know what you are taking. This is different from maybe some other products, but just be aware that those companies have taken an extra step. And by no means is this all of them. This is just the ones that off the top of my head I can remember and have made sure to see and point that out to my patients. Taking it in a next step. So there are 13 essential vitamins that we need, which we will go through all individually. So we have vitamins A, C, D, E, K, as well as our B vitamins that range from B1 to B12. Now, these are separate in the fact that we have both fat-soluble and water-soluble vitamins. So what's the difference? So our fat-soluble vitamins, first of all, are vitamin A, D, E, and K. And what it means to be a fat-soluble vitamin is that when you're taking in these vitamins, they are actually going to be stored in our fat. So you are more likely to see a toxicity with those vitamins compared to our water soluble. So our fat soluble ones are able to be stored and used at a later date. Whereas our water-soluble vitamins are ones that are essentially we take them in, your body uses what it needs, and then it will get rid of any excess. So that is vitamin C, and then all of our B vitamins, which we will make sure to dive in, but just kind of making sure that you have that difference. But ultimately, all of these vitamins are going to help your body grow and work efficiently. To kick us off, we are going to start with vitamin A, or also known as retinol. It is important for our eye vision, so our eye health, cell division, and even growth. And honestly, vitamin A deficiency is very uncommon in developed countries. So over 75% of patients they get enough vitamin A and do not need to worry about deficiency. So typically it's found in our eggs, milk, carrots. Men 51 and over need about 900 micrograms, whereas women need 700 micrograms. So a very small amount. Too much, you can see those vision changes, having mouth ulcers, some confusion, birth defects. But again, too little is night blindness is kind of the main thing that you would have. So that being deficient there, and then delayed growth or respiratory infections. I know when I was little, my mom always wanted me to make sure I was eating my carrots because of getting enough vitamin A to help with my eyes. Bummer it didn't work too much because I do wear glasses or contacts, but something to keep in mind is that your eye health, vitamin A will help with. Moving on next to vitamin C, ascorbic acid. So most people take vitamin C when they have kind of a feeling that cold coming on and just not feeling great. So it is an antioxidant that helps protect your cells and help with the healing process. So again, it makes sense that it's found in our citrus vegetables, so our oranges and tomatoes. Typically, men ages 51 and older need about 75 milligrams, whereas women 51 and older need 90. Too much, you're going to see kind of digestive symptoms and diarrhea, nausea, whereas too little, and this would be severe too little, is scurvy, which can essentially cause anemia, bleeding gums, or poor wound healing. So as this is one of our water-soluble vitamins, it essentially, if you're going to have a lot of vitamin C, your body's just going to excrete it out, usually in your urine. So again, something that even if you're taking extra of it, your body's just going to get rid of it. I do want to make note that vitamin C does increase iron absorption. So consuming too much vitamin C with your iron can cause iron overload. But it also makes sense that if you're taking some orange juice with your iron, then that will help the absorption of it. Next up on the block is vitamin D, which we are all familiar with, also called cholecalciferol. So it is very important for building and maintaining our healthy bone. We can get vitamin D from sun exposure. However, that does not typically provide enough vitamin D. So we do need to get some from our diet. And overall, vitamin D deficiency is one of the most common nutrient deficiencies, so something to be aware about, but it can be found in fatty fish, fortified milk, and cereal. Depending on your age, you may have different requirements, but typically patients 51 to 70 need about 600 international units, whereas patients over the age of 70 need a little bit over 800 units. Maximum dose would be 4,000 units. And honestly, too much is very rare, and too little makes sense. We're going to have kind of not as strong of bone, so at risk for osteoporosis and reduced mineral bone density. So why we see this one with vitamin D, and calcium will be its friend later. So we will talk about that in a minute. Moving on to vitamin E, or tocopherol. It is an antioxidant that protects your cells against any damage and make sure that your cells within your body are up to its normal function. So it's found in nuts such as peanuts and almonds. Men and women ages 51 and older need about 15 milligrams daily. If you do have too much, it can interfere with blood clotting. And again, too little is very rare because as it's a fat soluble vitamin, it is going to be held on to in your body. If you were to reach a rare level and have that, then you would be worried about having nerve pain. Vitamin K, or phytonadiene, it is found in our green leafy vegetables, so our spinach, kale, some fruits, but for the most part, I would say spinach and kale are our big heavy hitters. And men need about 120 milligrams a day, whereas women need 90 milligrams. Too much, it's very rare that you would have an anemia due to having ruptured red blood cells. And too little is, again, rare and having more bleeding instead of rupturing of the blood cells. This one does have one big drug interaction is warfarin. So with warfarin, essentially vitamin K is our antidote of if you were to have a bleed in taking warfarin. So as I'm in the coag clinic right now, I just ask that all my patients are taking a consistent amount of vitamin K or consistent amount of leafy greens so that we can manage your warfarin. Now this is different if you are taking Eliquis or Xarelto. Vitamin K does not interact with those. So just want to make sure everyone knows that some of those blood thinners do interact, specifically warfarin, whereas the others do not. And like I just said with vitamin E, if you are taking too much vitamin E with vitamin K, it might decrease the effect of vitamin K, meaning you may be at an increased risk of bleeding. So just something to keep in mind. It's always a balance with our vitamins, but if you're as long as you're taking a consistent amount, then you should be a-okay. Our B vitamins. So jumping into all of our the rest of our water soluble vitamins. So you'll see that it's going forward, it's a lot less likely that you'll reach a toxic amount or get too much because your body will excrete it, like I said earlier. But these B vitamins are important for making sure the body's cells are functioning properly. They help the body convert food into energy, so help with that metabolism, create new blood cells, and maintain healthy skin cells, brain cells, and other body tissues. So we will see kind of that common theme throughout as we go through them. Our first one is vitamin B1 or thiamine. So this helps the body generate energy from nutrients. It is necessary for the growth and development of our cells, typically seen in meat such as pork and fish, as well as those fortified breads, cereals, and pastas. Men and women need a very similar amount of 1.2 to 1.1 milligrams, and the likelihood of having a too little amount if you would have symptoms would be fatigue and irritability. And then a severe deficiency would be beriberi. Often, beriberi does affect the nerves, muscles, heart, and brain, so something we would want you to be monitored, but again, very rare that happens. Typically, the only time we see a patient deficient in thiamine is because if maybe their GI tract, so your stomach, is not able to absorb as much. Vitamin B2 or riboflavin, it's required for proper development of skin, lining of the digestive tract, blood cells, and brain function. You can find riboflavin in eggs, lean meat, and some green vegetables. Specifically, asparagus and broccoli are two examples for our green vegetables. Typically, men need about 1.3 milligrams and women need about 1.1 milligrams. So again, not very much in the grand scheme of things. Too little of it, you would notice like kind of a pale appearance and cracks in the corners of your mouth and your lips. And typically, again, this is only seen similar to thiamine if you're not having a proper absorption with your stomach. But again, very rare that it's seen. B3 or niacin. So this helps with your nervous system, digestive system, and skin health. So found in nuts, legumes, and grains. Men need 16 milligrams, whereas women need 14 milligrams daily. Too much, you have a kind of a flushing symptom, nausea, vomiting. That flushing is very typically located on the face, and it's more distinct redness as if you're blushing and being embarrassed. So that can be changed to an extended release formulation to lessen those side effects. Niacin can be used to help lower cholesterol, but again, not something that should be managed on your own. Would want you to be checking in with a provider. And this isn't something we go to first for our options of cholesterol medications, but it is something that maybe is on the table for you. But again, the dosages and strengths are different from over-the-counter and prescription strength. Too little would just be pellagra. And again, that is a very distinctive rash that's more on the hands, feet, calves, and neck, and sometimes even the tongue and mouth. They turn a very distinctive dark red, but again, typically not seen here. B5 or pantothenic acid is found in, it helps produce energy by breaking down fats and carbohydrates. It, again, like the other B vitamins, promotes healthy skin, hair, eyes, and even helps with your liver. It is found in a variety of foods, so it's not something that typically patients are deficient in. And adults essentially need 5 milligrams per day, so a pretty small amount. Vitamin B6 or pyridoxine is important for normal brain development and for keeping the nervous system and immune system healthy. So found in fish, beef liver, potatoes, and other starchy vegetables. In men ages 51 and over need 1.7 milligrams, whereas women need 1.5 milligrams. Too much, you can have neurological symptoms, skin lesions, sensitivity to light, nausea, and heartburn. Too little, you can have kind of peripheral neuropathy, meaning that nerve pain, or having that glossitis, so that glossiness on your tongue. Again, very rare that you would have too little, and if you did, again, it's due to it not being properly absorbed. B7 are biotin. So this one I typically think of as our hair, skin, and nails bonus item. So I remember in high school I was taking this just to help with my hair, skin, and nails. So that is what biotin is typically known for. It is found in liver, egg yolk, mushrooms, peanuts, milk, bananas, and vegetables. It is very well tolerated. No adverse effects really reported. Too little, again, having maybe some anorexia, so not eating very much, nausea, vomiting, and since it does help with your skin and everything, you may notice a grayish color of skin. And too much really isn't established because, again, as your water-soluble vitamins, this is going to be flushed out through your urine, essentially. B9, or folic acid, is very important for the brain and spinal cord development, especially for those that are expecting and having a baby. It is also important for DNA synthesis and amino acid metabolism. It is found in cereals, grain products, raw green leafy vegetables, and fruits. Men and women need 400 micrograms to 1,000 micrograms per day. Typically, women who are at a age of getting ready to have a baby, they need that higher range, whereas over time they can go back down to a lower range of that 400 micrograms. Typically, no adverse effects are known, and if you don't have enough, there is a folic acid deficient anemia. Neural tube defects is typically seen in our pediatric and neonate population, specifically the neonate population. Having a sore mouth, diarrhea, and confusion. B12 or cobalamin is an essential nutrient that helps the body create DNA, nourishes the brain and nervous system, and assists with the formation of healthy red blood cells. Found in meat, fish, poultry, milk, and fortified cereals. Men and women need the same amount, being 2.4 micrograms daily. And too much, you can have a headache or diarrhea. And too little, kind of tired, weak, not feeling as hungry. So this can easily be supplemented with our B12 injections, or that we see it's typically every week if you are found to be deficient. This one is a unique one, is with a patient who does take metformin. Sometimes your body isn't able to absorb the cobalamin over time, and this is after years of being on metformin. So it may be worthwhile to have a conversation with your physician about starting a B12 supplement, just to make sure that you are getting the appropriate levels and not having a deficiency where you're having that tired weakness and just overall not feeling as hungry. On to our supplements. So these are different. So I wanted to add in supplements just to, based on, some of those things that we see, like calcium, and other supplements that I thought were pretty important and got questions that when I was a pharmacy student. So we will go through them. Calcium obviously is very important for our bone and bone strength. And actually calcium's pair is vitamin D. So those two, actually the combo of them, typically our combo products of calcium, vitamin D, are the best because calcium and vitamin D, when taken together, are absorbed better. So something to keep in mind if you are looking at supplements over the counter, I would pick one that has both calcium and vitamin D. And with our calcium products, your body can only handle about 500 milligrams at a time due to absorption. So although it's recommended for men and women to have 1,000 milligrams a day, this is one of those that may have to be taken twice a day because of that absorption. And if you're having too much, you may have kidney stones that are mainly calcium little deposits. It can be constipating, I would say more so than nausea, vomiting, but something to keep in mind. Again, it makes sense that we're going to find calcium in our dairy products, but it can also be found in our green leafy vegetables and nuts and seeds. Fish oil. So I have the abbreviations, the EPA, DHA. So EPA being icosapentaenoic acid and DHA being docosahexaenoic acid. So these two are actually the preferred and the most studied for our fish oils and being beneficial to help with triglycerides, which we will get into the details on our heart health. There are plenty of different fish oils available over the counter. So just being sure to kind of taking a look at the label to see if it's the EPA and DHA. Typically those are paired together. So, and you can add up that amount for that total amount of fish oil that you need. It's also found in our fish and our seafood, which makes sense. So herring, salmon, mackerel, sardines, and trout. It can be beneficial for a couple different things. So it is helpful for lowering elevated triglycerides, which is a part of your cholesterol or lipid panel, reduce the risk of death from heart disease, and help with our rheumatoid arthritis or RA for inflammation. If you're wanting to take a supplement for high triglycerides, you're going to need quite a bit. So 2 to 4 grams of EPA and DHA, so our fish oil daily, but for your bang for your buck, you do get a 20 to 50% reduction in your triglycerides. As far as your heart disease and just overall our heart healthiness, you need a lot less fish oil, and that would just be 1 gram per day, but it may reduce the risk of heart disease and death by 25% in healthy patients with long-term use. So I put on here CoQ10, and its other name is ubiquinol or ubiquinone. And this one is unique in that it has the use of potentially helping with patients who are taking a statin, again for cholesterol, and this can help with that associated muscle pain because it helps kind of create improvements for your muscles. Found in red meats, so typically fatty fish, spinach, and oranges. It's pretty well tolerated. There's not a true established ideal dose. However, there is the drug interaction with warfarin, just making sure it's not, again, the main thing like with vitamin K foods is consistency is key, and telling your provider so that they can balance both the CoQ10, goodness, and warfarin together. But overall, it's going to help provide protection against in your cells and against any free radicals. Iron. So this is found in meats, plants, or fortified grains. Women typically do need a little bit more than men, so 18 milligrams per day versus the 8 milligrams per day. Too little, you may have kind of pale skin, fatigue, and too much nausea, vomiting, diarrhea, and stomach pain. And with both medications and food, this is something that you would actually want to space out from iron. So iron likes to bind to other things, which some things is good, but let's say you're on an antibiotic for pneumonia. So you're on levofloxacin. This is one of those medications that you actually want to space out because iron's going to bind to that medication and make it less effective. However, when taken with the vitamin C, like I mentioned earlier, we want that combination to make sure that you're getting the right amount of iron. So something to be aware about just when you're picking up an antibiotic, and if you're on an iron supplement, be sure to ask your pharmacist or doctor, how do I need to take this compared to my multivitamin, compared to anything else, because it should be spaced out. Although I don't think St. John's wort is used a lot, I did want to bring it up because it's from the plant family and it does have some value for depression and menopausal symptoms, specifically hot flashes. However, it's not for the faint of heart. There are adverse reactions with photosensitivity, having restlessness, some GI upset, dry mouth, dizziness, and confusion. And I don't think I could make this slide without having drug interactions because there are a lot. It could almost be its entire book. So this is one medication that I would not want any patient to pick up without consulting someone from the healthcare field, just because of how many drug interactions it does have. I do have dosing here, depending on the depression, 300 milligrams 3 times a day. So quite a lot of tablets would be needed to utilize. And overall, from the long-term perspective, it hasn't been well studied. And it does take a while for it to build up in your system. So if you are using it for depression or hot flashes, you're really not going to see any benefit for at least 2 to 4 weeks. This one should not be stopped abruptly, just because with kind of our depression treatment, then you may have withdrawal related side effects compared to those prescription antidepressant medications. Echinacea. So I picked this one because it is sometimes helpful if we're having a cold to supplement with. It is an immune stimulant to reduce cold symptoms and duration of our upper respiratory infections. There is kind of conflicting evidence about how much it will decrease the severity and symptoms if it's used right away and even continued for 7 to 10 days after feeling better. Long-term use has been studied for up to 16 weeks. Really and truly, it has been well tolerated. However, there are interactions with our immunosuppressive therapy, which makes sense because this is going to stimulate your immune system. And if you're on immunosuppressive therapy, like chemotherapy, then that's going to kind of counteract each other. As far as herbal interactions, there are none known. So that's something that's really nice. Echinacea is also very similar to elderberry that is also over the counter that can be used for flu-like symptoms. So again, something if you're needing to grab something over the counter, just be aware that that can help. Elderberry can help with flu. Again, I also want to mention that with these kind of supplements, echinacea, elderberry, and believe it or not, our airborne is basically just a super vitamin. So essentially, these may help with your cold, but in reality, you're just overloading your system with a lot of extra vitamins. And like we've talked about throughout this lecture, this presentation, is that there may be some vitamins that you're just going to get rid of. So that vitamin C, although it sounds like it's going to really kick things up and help you with a cold, if you're taking over 200%, that might be on the box, your body's just going to get rid of it. So just be cognizant when not feeling well, that yes, you can take it, but in reality, your body sometimes just needs to rest as well. So I just wanted to put my 2 cents in there for when we have a cold and kind of what to do. In summary, not all vitamins and supplements are created equal. I think, paying attention to if it is that USP mark, then you know what you're actually going to get. And being cognizant that not all of these have been studied. So if someone's mentioning, oh, I'm taking this elderberry and it's great, but if it's not manufactured by an appropriate site, then, or if it's from an online spot, like some Google things may not be legit. So just take it with a grain of salt and do your due diligence on finding as much information as you can on these products. And when in doubt, check with your healthcare provider if you have questions. We are always here to answer your questions with any medication and drug interactions. Your pharmacists at your local pharmacies are all willing to help if need be. And with that, I welcome any questions you guys may have.
Thank you, Allie. I took a lot of good information out of there. If you guys have any questions, you can enter those in the Q&A in the chat. And while I'm waiting to see if any questions come in, I do have a question for you. Or at least I have seen and know people who take like a B complex. Mm-hmm. Is there a benefit to those? What do you think?
I think there's a benefit. So I personally get migraines, and I found doing a B complex actually helps with my migraines. So I think there definitely is some value in that. It's not, something that's going to work tomorrow by any means, but overall as a supplement, I personally take a B complex, and I think that also just helps with kind of giving us that extra boost with our hair, skin, and nails, as well as just like that energy too.
Okay, let's see. What about magnesium? I am going to not say this correctly. What about magnesium L-theanine? Does it help clean out the brain at night while sleeping? It supposedly crosses the blood-brain barrier.
That is one I am not familiar with. I'm guessing used to help prevent Alzheimer's. I know there are a bunch of studies with that. The main thing I think I hear magnesium being used is also to prevent migraines and cardiovascular health. So I think there's likely still work to be done. And that would be one that I would maybe need a little bit more information on, in the aspect that there's a lot more that's coming to the market these days that hasn't been studied. And I would believe that that is one of them.
Okay, now I think, did you touch on elderberry?
Mm-hmm.
Okay, just curious, I know that echinacea is the purple coneflower, and I actually grow some of them. So are there any of these that we could grow ourselves and use? You know?
That is a good question. I mean, technically St. John's wort is from a root in a flower, but I don't recommend you growing that. Elderberry is also from a plant, which you could grow. However, the thing that you're going to have to be cognizant of is what you're growing and what you're then like taking in. You're going to have no idea of how much that truly is compared to like an elderberry or echinacea tablet, just because typically when it's made into a tablet or something that has gone through some form of synthesis and broken down into that.
Got it. Got it. I know some people use it in teas, but it sounds like using it in a pill format is going to be best.
Mm-hmm.
Okay. Are there any supplements that you should try to avoid?
I, for the most part, am always open to have that discussion. There are many supplements. I feel like it could be its own book on what is available now. And I think it's just having that conversation with your healthcare provider. There are I could have made this talk into a much longer talk, but ultimately the meds that have the most interaction are going to be your antibiotics, some of your blood thinners. So again, I would personally always ask, but that's my personality, is to ask the questions. If you are going to stay away from certain supplements, certainly St. John's wort is one of them. The other one is some of our G drugs, if you will, or G supplements. So your ginkgo, your ginger, your garlic, that does have unique drug interactions. So something that I would make sure to have a pharmacist check my medication list before I started those supplements.
Okay, so can you take more than one kind of magnesium at a time?
You could, but honestly, I don't think you would see much benefit from it, because ultimately what's going to happen is the magnesium is the core component, and depending on if it's magnesium sulfate, magnesium chloride, the thing that is different between those two is just the salt form. So you're going to break it down the same exact way. It's just the salt component is different on the magnesium. So really it wouldn't be any benefit to do together.
Okay, Allie, I want to be cognizant of your time. How much time do you have? Because people are just rolling in these questions.
Oh my goodness. I probably have about 5 minutes, and then I gotta eat and get back to clinic.
Okay, let me ask you this one. For a diabetic, will fenugreek, chromium picolinate, and alpha lopec acid help control blood sugar? Actually, here's the question. What are good supplements to help control blood sugar? How's that?
That works, yes. Fenugreek can definitely help. There is some data with even cinnamon as a supplement as well. Alpha lipoic acid can. Again, it's something depending on what else you're taking for your diabetes that I would also want to have that information, because if you're on metformin and you're on other agents, although supplements are great, sometimes our medications are what we really need to be having, and also making those diet and exercise changes as well.
Okay, let's see. And what about for the kidneys? Is there anything in a pill or liquid form?
To like protect the kidneys or to
Just
help?
let's say kidney health.
Okay, kidney health. For the most part, the best thing with our kidneys is making sure we're taking care of everything else. So often our patients that have some kind of heart condition, it can put a strain on our kidneys, or even diabetes can put a strain on our kidneys. So making sure you're staying hydrated and making sure you're taking your medications appropriately. That's kind of going to be our best thing. As far as supplements specifically for the kidneys, nothing is ringing a bell. I know there is specific multivitamin, that's what I'm looking for patients that are on dialysis, because there is as a patient is on dialysis, then the way we get rid of some of those vitamins is different. So that would then need to be altered.
Okay. And are there any side effects to starting and stopping a supplement regime? Sorry, this is our last one.
No, that's okay. It depends on the supplement. So for the most part, you're like, let's say St. John worts. If I haven't mentioned it enough, I'm not a fan of it, but it's one that is going to take some time. So just like some of our other supplements, that's going to take some time. So let's say I start taking a B12 complex and I want to get some of my levels checked. It's not going to be like tomorrow I'm going to start having an extra feeling or like feel better and have all this extra energy. It is going to take time for it to kind of rise up in your system, as well as time for you to go down. I don't anticipate you having a any form of withdrawal with most of the vitamins and supplements. It's going to be very gradual on either the way up or down.
Okay. Well, Allie, I really appreciate you taking the time to give this talk and for answering all of the amazing questions. So we do have a couple that we didn't answer, and I apologize for that, guys. I will see if I can't find an answer and send it out to you. This is going to be posted on YouTube. I'm sure that you got the notification that it's being recorded. I will be sending out an email to you and letting you know what that link is. Now, some of you have used a code name or maybe not your full name. I will let you know you might get the email that says, sorry, we missed you. So I apologize for that now. Sometimes people are a little bit hard to track for your email addresses, but the good news is everybody will get the link one way or another. So, all right. Well, Allie, again, thank you so much for your time. And
thank you for having me.
I appreciate you. Have a good day.
Thanks. You guys too.
Bye.
Bye.